Everyone, so in this video we are going to talk about an interesting topic, myositis ossificans. It is metaplasia of the intramuscular connective tissue that leads to an extraosseous bone formation. This extraosseous bone that is formed is without inflammation. The causes for myositis ossificans can be a trauma to muscle or soft tissue that leads to hematoma formation within the muscle, or it may be injury to the joint that leads to hematoma around the joint. Also, in children, severe injury to joint leads to stripping of capsule and periosteum. These all things leads to a hematoma formation, and hematoma eventually ossifies. One of the theories says BMP3, BMP4 and tumor necrosis factor changes the fibroblast into chondrocytes within the connective tissue of the muscle, and this leads to ossification of a hematoma. Now, this hematoma ossification in the joint will restrict the joint movement. Around the muscle, it can restrict the range of motion and can lead to swelling and pain. Presentation can be a painless mass 2 to 3 weeks after an injury. This is common among young male athletes with an injury in quadriceps or shoulder having a painless mass of within 2 to 3 weeks of injury. This may be due to myositis ossificans. It may present as patient may present with pain, decreased range of motion and swelling too. Also, if it is in the joint, it can lead to restricted joint movement. X-rays, in case of active myositis, we see a fluffy margin, and in case of mature myositis, we see a bone trabeculated with well-defined margins. Here we have some of the X-rays. Let's have a look at it.
So here we have X-ray on the left of shaft of femur, and we can see intramuscular calcification in the quadriceps muscle, which has matured, showing the trabecula and has a defined margin. On the right, we see a calcification around the joint in the elbow joint. This will be causing the stiffness in elbow joint.
So now about CT scan. In CT scan we see axial calcifications, and differential diagnosis of myositis ossificans is an extraosseal osteal sarcoma or a paraosteal sarcoma. In both of these cases, the myositis ossificans can be misdiagnosed as a sarcoma, or sarcoma can be misdiagnosed as a myositis ossificans. One more point to note is that in histopathology of myositis ossificans, we see features of an osteosarcoma itself. So it may be confused with osteosarcoma in histopathology. The treatment is to rest the limb, and for pain, we give NSAIDs. Physiotherapy is of use to continue the motions so that the passive movements of the joint continues. The size of the mass decreases after 1 year, and we have to follow up this myositis with follow-up x-rays. Surgery is only done when the lesion matures. A mature lesion is identified by a trabeculated bone with well-defined margin, as we studied in the x-rays. It is also known myositis ossificans is one of the deformity or disease in orthopedics which is known as do not touch disease. In this case of myositis ossificans, no massage is done because massage promotes inflammatory cytokines and promotes conversion of the fibroblast to chondrocytes and hence promotes ossification. So no massage is done in case of myositis ossificans. So this was a brief about myositis ossificans. Hope you like it. Thanks for watching.